very good evening to everyone. Welcome to the forum on HIV topic. First of all, let me introduce myself. I am Syarah Nadia binti Mat Zaid and currently working in Head of Department in Penang Medical College, Malaysia. Today's topic is about HIV disease. This virus is first reported in 2008 and has caused death more than 10,000 Malaysians. Every day, 15 Malaysians are diagnosed to have HIV positive, and in 20 years' time, the new cases increases by 883%. So far, there is no cure for this HIV. So without wasting any time, let us introduce you to our panels today. So our first panel today is Dr. Nur Izaitira from HUKM. Welcome, Doctor. The next is Dr. Tiara Hanani binti Zamzuri from HUSM. Next is Professor Dr. Aina binti Abdul Aziz. She is from Immunology from HUSM. And the last one is Dr. Fatima Aina binti Nawi, currently doing research on HIV stages in HUKM. Welcome and thank you for joining us, doctors. So without wasting any time, let us proceed to our first beginning question today. First of all, let's ask Dr. Izaitira. Can you explain a little bit about this HIV disease?
Thank you, Ms. Shahira. On the journal written by Kenny Hetmeyer and Hiv Prevention, HIV stands for Human Immunodeficiency Virus. It is a virus that attacks our immune system or our body protection against virus in our body. It destroys the white blood cell that is known as CD4 cells or T cell. The function of this cell is to protect our body against virus. If the number of CD4 cells counts get low, our body is more susceptible to illness. It stands for the acquired immunodeficiency syndrome. It is the advanced stage of the HIV. When the CD4 cells get dropped lower, the person are more the body protection against virus are more lost ability to fight infection and virus.
So that's all, Doctor. So thank you, Dr. Izai. I've heard that the virus is first found in monkey species in Africa. So is that true, Doctor?
Yes, it is true. HIV epidemic started in Africa and largely found in the largely asymptomatic in the monkey, and it makes its way directly spread by person-to-person contact. If you want to know, the monkey meat is the major source protein in the several Central and Western Africa, and the processing of the monkey meat affect exposure individual exposed to the blood and cuts in the skin that could provide a protein to the host.
Thank you, Dr. Izai. So, based on Dr. Izai's explanation just now, it is fair to say that AIDS are final stage for HIV disease. We can also say that this virus is originated from the monkey species in Africa and then being transferred to the human being. Now, we already know about what is HIV and the history of HIV. So, let us proceed to the next question. So, Dr. Tiara, can you explain to us how this virus is transmitted among our kind?
Assalamualaikum. Thank you, Ms. Shahira. There are a few main ways how this virus spread. Firstly, is through sexual intercourse, having unprotected sex. This means having vagina or anal intercourse without using a condom, or having oral sex without using a latex barrier with a person infected with HIV. Clients of sex worker make up the largest population of people with highest risk, which is 0.5% to 15%, and the usage of condom in paid sex are still low in many countries. Estimates suggest that between 25% to 40% of HIV infection infected wives and girlfriends, while most men are infected through paid sex with other men, and drug injection. The second way is through needle sharing. They share needles to inject drugs or steroids. This disease can also be transmitted by dirty needles used in tattoo making and body piercing. Sharing needles is one of the major driving factors of spreading of HIV throughout Asia. Epidemics in China, Pakistan, Vietnam, and part of India are due to sharing needles. In China, 28.4% of all people infected with HIV are mostly believed to be caused by needle sharing. Thank you.
Thank you, Dr. Tiara. So, doctors, other than unprotected sex and having a needle sharing, is there any point or any other ideas to be elaborated on how this virus is transmitted through all kind?
Yes, sorry, I do have something to add. So, the other ways that this virus can be transmitted is from pregnant women to her babies. One baby to women with HIV or AIDS can get HIV from her mother during birth or from breastfeeding. The coverage prevention of mother to child transmission service is also very low in Asia. East, South and Southeast Asia, about 30% of pregnant women were offered an HIV test. Actually, this was a great improvement compared to 18% in 2009, but however, it is still a very low percentage compared to the other regions in the world, such as Eastern Europe and Central Asia, 59%, Southern and Eastern Africa, 61%, and Latin America and Caribbean, 61%. That's all.
Thank you, Dr. Aina. So, in conclusion, based on our doctor's discussion just now, the virus is transmitted to our kind is transferred through the body's fluids such as unprotected sex, needle sharing, and pregnant mother. So, doctors, sorry to interrupt, but we have a question from our audience here. Can we get infected by the virus through kissing?
Thank you for the question. So basically, kissing is safe because usually kissing involves only saliva, which is the virus cannot be transmitted through saliva. This is because the virus that contains in saliva does not strong enough to affect a healthy person. But it is still risky if the person continues to kiss until the knee bleeds. In addition, the virus also cannot be transmitted through physical contact, such as hugging, holding hands, sharing drinks and food, and having a safe sex.
Thank you, Dr. Aina. So, therefore, it is a confirmation from the experts that this virus is not going to be transmitted to the others through the physical contact. So now, we should never isolate persons who are HIV positive. Instead, we should give them encouragement and support in order for them to have a better life. I believe that many of us are still clueless how this virus, HIV, can transform into AIDS. So now we invite Dr. Fatin to give a detailed explanation to us how this virus is developed and the symptoms to the infected person.
Assalamualaikum. Thank you, Ms. Shira. Basically, there are 3 stages of HIV. Within 2 till 4 weeks after HIV infection, many but not all people experience a flu-like symptoms described as the worst flu ever. Symptoms can include fever, swollen glands, sore throat, rash, fatigue, muscle and joint aches, and headache. In this stage, this is called acute retroviral syndrome or ARS, or also primary HIV infection. In the initial stage of infection, many individuals who are infected do not show clear symptoms of the disease and are called carrier or HIV positive.
So, Doctor, I was saying that the infected person do not know they are infected in the initial stages.
Yes, it is.
So, the symptoms were not too clear and the patient may not realize they were infected. So, what about the further stages?
The second stage is clinical latency stage. Latency means a period where a virus is living or developing in a person without producing any symptoms. During the clinical latency stage, people who are infected with HIV experience no HIV-related symptoms or only experience the mild ones. This stage is sometimes called asymptomatic HIV infection or chronic HIV infections. During this stage, the HIV reproduces at a very low level, although it is still active. If we take antiretroviral therapy or ART, you may live with clinical latency for several decades because treatment helps keep the virus in check. Eventually, when the immune system fails, the infected person may contract pneumonia, which is lung inflammation, Kaposi sarcoma, which is skin cancer, lymphoma, the cancer of lymphatic system, or a combination of any of these. Following initial infection, you may have no symptoms. The progression of the disease varies widely among individuals. During this period, the virus continues to multiply actively and infects then kill the cell of the immune system. As we all know, immune system allows us to fight against the virus, bacteria, or other infectious causes. But in this case, the HIV virus attack and destroy the cell that are the primary infection fighter, which are called CD4+ or T4 cells.
Thank you, Dr. Fatih. So all of us should be always aware to our body, because we can see the symptoms clearer, we are HIV carrier or not. So thank you, doctor. From what I know, after the second stage, it is the progression to AIDS. What can you say about this, Dr. Rizal?
Yes, the final stage of the HIV is the progression to the AIDS. If you having HIV and you are not taking ours, it will weaken your body immunity system. The definition of the AIDS include that the person has lower than 2,000 CD4 cells per microliter of blood in their body. The most common symptoms in people that have AIDS, such as coma, persistent diarrhea, vision loss, and problem in swallowing. The others, all of these are infections that caused by the parasite, fungi, and other organisms. A person that have AIDS usually prone to develop cancer, such as cervical cancer, cancer in the immunity system, lymphomas, and Kaposi sarcomas. Kaposi sarcoma cause red, brown, reddish, purple, or brown in the spot in the skin or the mouth of the person. Usually, the person that they have AIDS, their body immunity system have lost the ability to fight infection in their body. That's all from me.
Thank you, Dr. Rizal. So, based on what Dr. Rizal have just said just now, the progression for the HIV to transform AIDS is very time-taking. The virus develops by stages, and as the stages get worse, the symptoms become more clearer. So, let us proceed to the next discussion. Dr. Aina, what do you think is the suitable way and the best way to prevent ourselves from getting this virus?
Okay, thank you, Ms. Shaira, for the question. So, Asia has been the base for some extremely successful large-scale HIV prevention program. Well, it is founded that particularly campaign in Thailand and Cambodia have led to significant decline in HIV infection level and HIV prevention aim at sex workers and their clients have played a large role in this achievement. In Tamil Nadu, India, HIV prevention initiative have a substantial impact. High-profile public campaign discourage risky sexual behavior and no condoms more widely available, and also provide STI testing and treatment for persons who need them. So, to prevent HIV infection and AIDS, we must practice a healthy lifestyle, such as avoiding the person whose background or health status is unknown. Next, we also must avoid casual sexual contact with prostitutes or drug addicts. If sex cannot be avoided, such as sex between husband and wife, so condoms should be used to reduce the risk of infection. Then we also must avoid sharing shaving razors and toothbrush, which can be contaminated with infected blood. So, like I said before, this virus cannot be transmitted through physical contact.
Thank you, Dr. Aina. So there are many ways that we can practice in order to prevent ourselves from getting this virus. And as we know, there is no cure for this HIV disease, but still we have to get the treatment in order to get a better life. So Dr. Tiara, can you give us your view about what medication that should HIV infected person take?
Thank you, Ms. Sharia. Since there is no drug that can cure HIV and taking a single medicine won't stop HIV from harming you, taking 3 different HIV meds do the best job in controlling the amount of HIV virus and protecting your immune system. The 3 drugs regimens are cocktail, antiretroviral, which is ARV, and highly effective antiretroviral therapy, HAART or ART. At this time, there is no cure for HIV, but medications did the best in fighting the disease and its complication. Treatments are designed to reduce the HIV virus in your body, keeping your immune system level at its best and decrease the complication caused by HIV. The US Food and Drugs Administrative, FDA, has approved a number of drugs that can be used to treat HIV. Most medications have side effects, but individuals may react differently towards different medications, so the side effects are varied. Nucleoside reverse transcriptase inhibitors. This drug will stop and interrupt the HIV from duplicating, thus lower the spreading of HIV in your body. Combination of R and CI made it possible to take at lower dose and maintain your immune system. These drugs is Combivir, Trizivir, Epzicom, and Truvada. That's all.
Thank you, Dr. Tiara. So, based on what Dr. Tiara said, even though there is no cure for HIV and AIDS, but still we have to get treatment and medication in order to have a better life. So HIV is world epidemic. Although we are making new advances in combating this virus, there are many flu infections every year. The best way to keep yourself safe is to stay informed. You should know how it spreads and how to prevent it. You should take a HIV test and prevention if you are involved in any risky behaviors. You should tell the others about the importance of the prevention on this matter. There is no cure for this virus, so there is no room for ignorance on this matter. HIV is not a death sentence that it was 30 years before. People are living longer life with the virus than they ever have before. Whether you are positive or negative, please take the time to learn more about HIV and pass that information to the others. It is never too late. With that note, I thank you. Thank you for all the panels and for joining us on this forum today. Till see you soon.